Index, uh, Index patient Mr. X, 21-year-old male, single, unmarried, Hindu, lives in a joint family and studied till class 12. And he is a resident of Dehradun, Uttarakhand, belonging to middle class socio-economic status according to the modified Swami scale. Informant is the patient's paternal uncle, who is 32-year-old male, has his own laundry business, studied till class 12, living with the patient throughout the illness, and the patient himself. Now, history given is clear, consistent, and is given in a chronological order and corroborated amongst both the informants. History is reliable and adequate. Chief complaints, according to the paternal uncle, are demanding behavior since 12 months, self-harm attempts since 11 months, and generalized tremulousness since 10 months. And according to the patient, is low mood since 12 months and generalized tremulousness since 10 months. Onset is insidious, course is continuous, progression is continuously deteriorating. Total duration of illness is 12 months, and age at the onset of illness of the patient is 20 years. Predisposing factors are sexual abuse by maternal uncle, neglect by the step parents in childhood. Perpetuating factors are not good relation with his stepfather and stepmother, and precipitating factors could not be extracted. History of present illness. Patient was apparently well 12 months back, doing his day-to-day activities like going out to hang out with his friends, dropping his younger siblings to school in the morning, helping his paternal uncle in laundry business, and he had just passed his 12th standard and was planning to join the college when his paternal uncle noticed that he had become a little bit demanding than he was before. He would ask his uncle to cook food according to him, otherwise, he will not have the food. He would demand for a new bike, a new phone, and would insist him to get admission in a college of his own choice. He would not take meals if food was not of his choice and if other things are not done according to him. After 1 month of this behavior, one day his paternal aunt and uncle had an argument regarding the financial issues of the home. So he started talking in between them and had an argument with his paternal uncle. Then the very next day, when he was sitting with his uncle, he advised him to not speak in between if two elder people are talking and are having any conversation. So he got very upset regarding this. In the morning, when they were having breakfast, his uncle refused to have his meal, and as he was not feeling well. But the patient took it the other way and thought that his uncle is not having his meal because of the argument with him. So he repeatedly forced him to have his meal, but he refused. After which, patient started shouting and shaking out of anger very vigorously and went to his room and banged his door very hard. Following which, his paternal uncle decided to not to take him to work along with him on that day. Following which, patient got even more frustrated and repeatedly called his uncle to pick him up from his home. Otherwise, the consequences would not be good. Then he called his uncle and said, "मैं जा रहा हूँ," and he did this twice or thrice. Then his uncle decided to fulfill his demands. He was on the way from his workplace to his home. Suddenly, he got a call from his neighbors that the patient tried to hang himself from the ceiling fan with the help of a cloth. But his younger brother and one of his neighbor intervened and prevented the mishap. After which he became unconscious and was rushed to the Indresh hospital, where he was admitted in ICU for 8 days. And when he tried to get up from his bed after he came out of ICU, his uncle noticed that his whole body was trembling so much that even he could, when he tried to help him out, he could feel the shaking of his body. He was then shifted to the general ward and discharged after 25 days of stay. But his vigorous shaking of his whole body while trying to walk or to do his daily activities did not resolve. He started having difficulty in doing day-to-day activities due to this, like going to washroom, having his own meal, and whenever he was not even able to take a bath by himself. When he went home, he felt very guilty that he should not have done what he did to himself. But his anger outbursts and demanding behavior also continued along with this tremulousness. He would get very irritable even on very minor issues if things were not done his way, and would repeatedly threaten his family members that he will harm himself if they will not do things according to him. Even when he could not perform his daily activities, he would demand for a two-wheeler, and when his uncle would refuse, he would again threaten him to that he will harm himself. Patient reported that during this time period, his but according to the patient, during this time period, his interest in previous pleasurable activities like doing drawing, art and craft, and hanging out with his friends decreased. His interaction with his friends and family also decreased, and he felt that he has hit a low, and his confidence also decreased. He could not intermix even with the new people as he considered him to be, if he was able to do earlier. And he became a little more hesitant to express his feelings. He became very sad regarding the fact that he could not do his day-to-day activities due to the tremulousness, and he started having the thoughts that he will not be normal as he was earlier. Even after during this time period, he would not be able to even hold the cup of a tea whenever they would his family member would offer him a cup of a tea. The tremulousness would be so much that he would spill all the tea all over himself, and but even after these symptoms, he would repeatedly demand for a new bike uh, and a new phone and would continue to threaten his family members. When due to this, he again attempted a second self-harm attempt in December 2023, and but at that time, the cloth which he used unwinded itself, and he suffered neck injuries and abrasion all over his neck, and he was again rushed to the hospital. uh, but when he was discharged after stay of 15 days, his improvement in tremulousness improved for 2 months. There was no tremulousness for 2 months, but his symptoms of demanding behavior and irritability, demanding behavior was still there. So, following which, the patient went home, but again he relapsed. So he came back to Indresh Hospital this time in March 2024. During this time period, his sleep, appetite, bowel, bladder, and libido was normal. Negative history. There is no history of any significant head injury. There is no history of any abnormal body movements that were abrupt and associated with generalized stiffening with rapid recovery. There is no history of fever, vomiting, unexplained weight loss, no history of specific developmental disorder of speech, no history of any reckless behavior and breaching of rules. There is no history of any substance intake, no history of suspiciousness, self-muttering, self-smiling, hearing voices, or seeing things. There is no history of thoughts being introduced into or taken away from mind by an external agency against his own will, own thoughts being heard aloud, or being known to others against the will. There is no history of breaks or interpolations in train of thought. There is no history of abnormal behavior such as excitement, posturing, flexibility, negativism, mutism, stupor. There is no history of sustained over cheerfulness, over religiosity, over familiarity, big planning, over grooming, tall claims, increased libido. There is no history of repetitive thoughts or acts. Treatment history. Patient was admitted in Sri Mahendrash Hospital once in medicine department following a suicide attempt. He was admitted for 25 days in March last year, and he also had an ICU admission for 8 days. And he has been admitted thrice earlier in psychiatry department of Sri Mahendrash Hospital for similar complaints in April 2023, December 2023, and February 2024. But the treatment history is inadequate. These were the medications which he took. Sir, April medications available in April to December. He had only prescription of December. He was given tablet clonazepam uh, 1 mg thrice daily. But side effect was he had excessive sedation. He was also kept on a combination of sodium valproate and valproic acid, escitalopram, and risperidone. He was compliant to the medication, but he reported minimal response to these medications. Uh, in on 14th December 2023, he was started on lithium, uh, 900 mg in two divided doses. Uh, on 6th January 2024, he was started on lithium, 300 mg twice daily, Lopez, lorazepam 1 mg in two divided doses, and lurasidone 40 mg. This medication पे sir इनको there was good response in tremulousness, and but sir there was very minimal response in the demanding behavior and irritability and anger. He was also given gabapentin 100 mg BD and tablet escitalopram. These medications had showed good response for 2 months. But after 2 months, he was compliant. According to him, he was compliant to the medications, but still tremulousness was. Past history, there is no history of any significant general medical condition like hypertension, diabetes mellitus, asthma, hypothyroidism, etc. There is no history of any past significant surgical history. There is no history of any past psychiatric illness. Family history. This is a pedigree analysis of the. Sir, there is a significant history of demise of father at the age of 65, but the cause was unknown. He was a businessman by professor. There is history of BD smoking in grandmother. Uh, she's currently 65 years of age and she was a housewife. There is history of demise of biological father at the age of 45 years. Uh, Due to an RTA. He was a businessman by profession. So this happened 17 years back when he was around 4 years of age. Then there is history of suicide in biological mother uh, 10 years back uh, when she was of 35 years of age and aggressive behavior, low mood, and she was a businesswoman by profession. But sir, history is not reliable regarding the low mood and aggressive behavior, but there is history of suicide by hanging. Sir, there is also history of demise of elder brother when he was of 8 days old. Uh, and sir, currently patient is living with his younger paternal uncle uh, along with his wife and his two children. And sir, his biological mother was then married to his first paternal uncle. But after her demise, he married another woman. So for 3 to 4 years, he stayed with his stepfather, who was his paternal uncle also, and stepmother. Uh, Second, he's second in the order of three siblings of a non-consanguineous marriage. He lives in a joint family. History of suicide, low mood, aggressive behavior in mother. History suggestive of harmful pattern of alcohol intake in stepfather. Patient has a cordial relationship with his paternal uncle, but not with stepfather. Head of the family is the paternal uncle. Patient is closest to his paternal uncle, and family is supportive towards the patient illness and understands the importance of regular follow-up and compliance. After the demise of his biological father, when patient was 4 years old, his mother married his paternal uncle, and he started living with them. When the patient was 11 years old, his mother also expired. So his stepfather, who was his second paternal uncle, had second marriage. His stepmother didn't had any interest in the affairs related to the patient and his sister, like feeding them on time, taking their responsibilities related to studies, sending them to school on time. And she also used to scold and beat them. Birth history, full-term vaginal delivery, hospital birth, but there is query that he cried immediately after the birth. There is no complications, history of complications perinatally. Birth weight was around 4 to 5 kgs. His uncle reported 7 kgs, but he was not sure. No history of fever, cyanosis, prolonged jaundice, breath holding spell, or prolonged body movements, or admission in NICU, except breast milk on day of delivery and was exclusively breastfed for 6 to 7 months and then was started on occasional feeds of honey, banana, cerelac. There is no history of exposure to X-ray or toxin, but it is query. No history of any antepartum or postpartum complication. All developmental milestones achieved as per age according to his paternal uncle. Completely immunized as per national immunization schedule. No history of maternal deprivation. Childhood history born and brought up in London. There is no history of being bullied by other children, temper tantrum, no history of hyperactivity, inattention, repeatedly bullying other children, stealing, lying, setting fire, nail biting, thumb sucking, or stuttering during the childhood. Scholastic and extracurricular activities. He started schooling at the age of 4.5 years. He was shy in school and did not take part in extracurricular activities. He had an average scholastic performance and scored average marks in his test. Had only few friends, one or two, and there was excessive sensitiveness to setbacks and weakness. He passed 12th, 10th standard with second division, according to his uncle, and flunked in class 12. In, but he never went to college thereafter. Sexual history started masturbating at the age of 14 years, gained the sexual knowledge from the school. And there is also history of childhood abuse at the age of 11 years by the maternal. Forensic history, there is no history of arrest, no history of any impending legal case. Pre-morbid personality, he was ambitious and wanted to become an engineer. A cordial relationship with family, except his stepfather and stepmother. He was hesitant and had difficulty making new friends. I have only few friends, but they were his long-term friends, and he was responsible towards his work and family. Would make decisions after consulting with his paternal. Uh, he also had an interest in art and craft and invariable preference for solitary activity. Mood was stable, however, always hesitant in expressing his inner feelings of anger and sadness, and would often get angry over the minor issues. He would abide by the laws and respect the social norms and excessive sensitiveness to setbacks and defaults. Had a regular sleep-wake cycle, rhythmic bowel bladder habit. Impression he had a well-adjusted uh, pre-morbid personality. On general physical examination, body weight is 63 kgs, height is 165 centimeter, and BMI is 23.1. Identification marks are as follows. And there was no pallor, icterus, clubbing, cyanosis, lymphedema. Temperature was aphrodite, but there was ligature mark present on the neck near the Adam's apple. Uh, Pulse was 84 beats per minute, regular normal limit, and BP was 1.2 by 78 mm of Hg, which was measured in the right arm. On systemic examination, respiratory system examination was not within normal limits, cardiovascular system examination was within normal limits, and gastrointestinal system examination was also normal. CNS examination, cranial nerves were intact, sensory examination was motor examination was normal, tone, power, bulk was normal, and reflexes bilaterally upper, lower, all the superficial and deep tendon reflexes were normal. On cerebellar signs, titubation was absent, pendular knee jerk was absent, but intention tremors were present. And during the finger nose test, tremors were also present. Nystagmus was absent, tandem walking was impaired, and posterior column test, on posterior column test, Romberg's test was positive. Mental status examination, general physical appearance behavior, ectomorphic build mate entered the room unaided, accompanied by his paternal ligature marks present on his neck, walking very slowly and his legs were trembling. Sat on the chair provided. and returned the interviewer's greeting. Patient had drooped shoulders, making his posture bent. Dusky complexion, wearing a blue colored t-shirt and a black colored track pants, dressed appropriately as per his surroundings. Dirty nails and hyperpigmentation on the nail. Hair not properly combed, and clothes, but clothes appeared clean. He also appeared as per his stated age. Appeared to be in touch with his surroundings. Eye contact initiated but not sustained. Attitudes was cooperative. Rapport established with motor activity was decreased. Speech was decreasing tone, volume, and intensity, but it was clear and coherent, goal directed with a reaction time. Attention, he was able to take it forward to 5 digits and use it backward up to 3 digits. He was also able to do serial subtraction 3 to 4 times, and he also repeated the months of the year backward in reverse. Impression, attention was observed and sustained. Orientation, days of the week, said Sunday, time of the day, said evening. What season is this? Said summer. Where are you currently? In Gold Hospital, English Hospital, Dehradun. Who is accompanying you? Is Peter. Impression oriented to time, place, and person. Memory. I asked him, what did you eat for dinner yesterday? He told me roti and aloo, and for breakfast, he told bread, pakora, and tea. Remote memory. I asked him the name of his school he used to went 2 years back. Sri Guru Ramaya School. And I also asked him when did he bought his first bike. So he told 2021, which I corroborated to this preparation. Uh, in general, point of information, why is 26th January celebrated? He said Constitution was established. I also asked him the function of the lungs. He said to breathe, and also asked the national animal of India. He told tiger. He was able to do verbal complex calculation, uh, but this is a written complex sample which I gave him, but it was actually I was not able to make what I had here. Extract ability. I asked him नाश्ता जाने आमलेट डेटा, so he was able to tell खुद को काम नहीं आता दूसरे को काम. खाली का बैंगन ना दो इसका बंदर के जाने किसका जिसको जिस चीज की समझ नहीं है उसको उसके बारे में. He was able to tell the difference and similarities between apple and banana. So impression is abstract thinking is intact. Uh, so this is another sample. I tried to test the frontal lobe testing. Frontal. So asking to do the factors. Also asking to do Archimedes squaring. Cheeky of it was anxious, active, create reactive, normal wave, and not complicated. But stream was normal, form no formal thought disorder. Content being reported of ideas of helplessness, hopelessness, and worthlessness. And position was settled. Perception was normal. Judgment, test judgment was intact. Social judgment, he would behave very rudely with his paternal uncle and paternal aunt in the walls. And so socially it is not intact, but personal was intact. I asked him regarding the plans of the he told me that he will help his uncle out, take care of his younger siblings, and complete his work, studies work. Inside was grateful because he was accepting and denying at the same time. Was in the hospital, he was admitted from the emergency at the section 89, and the basic investigation was done as he was admitted earlier. So MRI brain was done. It showed small lymph nodes in the middle brain. and he was kept on these medications during his stay. Diagnostic formulation. Mr. Himanshu, 21-year-old male, second in the order of three siblings, currently unemployed, belonging to a Hindu joint family, their socioeconomic status, with history of low mood, aggressive behavior, and suicide in mother, harmful pattern of alcohol intake in stepfather, pre-morbidly well adjusted, presented with the illness of 12 months duration, which is insidious in onset and had a course which was continuous and progressively deteriorating, characterized by demand since 12 months, self-harm attempts since 11 months, generalized tremulousness since 10 months, with ligature marks present on the neck. General physical examination, occasional tremors were present, armwork was present, and tingling movement was impaired. On initial eye contact was initiated at nothing. In motor activity was decreased. Speech was decreasing to the intensity, with impaired social judgment and insight rate. Currently kept in diagnosis of associated motor disorder. The secondary differential of cerebellar and so the moderate. So there have been many stresses. So during the when there was very few incidents when you would walk very normally when nobody would see him. Then it was the generalized tremulousness. Mm, because there is a chemical relationship because the stress is there. And there is no stress any other stress. Seizure disorder. Yes, ma'am. There have been incidents where even there is there have been instances like at a very young age, they started started to get so that my parents left. So, you can July, this is the district. Maybe discuss regarding it. You mentioned that you also said sexual. See that से बीच बीच में थोड़ा bit
अगर तुम्हें लगता है कि कुछ डिसऑर्डर का मतलब है इससे इस केस में पॉजिटिव डेमोक्रेटिक डिसऑर्डर जैसे टेम्पररी ये तीनों जो किस्म टेम्पररी लिस्ट पे यूज करते हैं रेस्पिरेटरी मिला नहीं बस कैसे पाएगा रेस्पिरेटरी गुड टेक करनी क्या स्पेसिफिक काम इस लेट टू present condition of the patient is living uncle and aunt and with stepfather and stepmother is not present there. Stepmother is separated last 15, 13, 14 years. So currently stepfather is there. He is also stepmother. Stepfather. 5 6 साल 5 6 साल पेशेंट को डिस्ट्रेसफुल सर जब पेशेंट मिस्टर फादर को अपने about the past life event या तो कुछ अभी उसके बाद अगेन बात recalling of those subconscious or unconscious mechanisms जिसने अब रेस्ट्रिक्ट कर दिया उसे because of what होता है
It's a recent regarding like
एक्चुअली के बारे में पूछो तो बहुत एक्चुअली बनाया तो उससे लेटर पर सब रिलेशनशिप रोमांटिक बेसिस पे सारे बात के बारे में तो बता दें अगर उससे अपनी एजुकेशन परफॉर्मेंस के बाद या उसके लाइफ मिशन के बारे में बात करें तो आगे तो वो कैसे आ जाए लोगों की तो मन तो सब कुछ के बिल्कुल बिल्कुल अपनी डिस्ट्रिक्ट The grandparents had this one girl child, then one boy child, then one boy child. So who is
ये वाला सब ये वाला एरो सब गलत है यहाँ पे
गलत है ना कहाँ पे
तो
गलत
ये
दिखा रहा
वाला
है
एरो इस पे
हाँ तो वो तो पहले ग्रैंड पेरेंट्स मतलब है या
पे आ गया
वाइफ के पेरेंट्स हैं या मतलब मदर के पेरेंट्स हैं या फादर के पेरेंट्स हैं जो
सर
ग्रैंड पेरेंट्स
सर ये वाला एरो यहाँ पे आ तो
हैं कौन सा है
सर ये वाला जो एरो है सर ये इस पे आना था सर
हाँ मतलब ये पैटर्नल ग्रैंड
बिल्कुल
पेरेंट्स और ये जो उसने मैरिज की वाइफ तो होगी तो वही पैटर्नल ग्रैंड पेरेंट्स की काम होगी वो भी तुम्हारा एरो गलत है वो सन ही होगा उनका ना वो भी
हाँ जी सर ये इधर आना था सर
एक चाइल्ड में एक पेशेंट
सर ये ले सर वो पेपर मैंने ठीक लिखा था पीपीटी
और एक सिस्टर है प्राइवेट जॉब में,
जी
वो सिस्टर
Youngest.
कर लीजिए।
ठीक है
ठीक है, तो वो किसके साथ रहेगा?
सर
तुम्हारी इसमें है नहीं कहीं आएगा?
सर मेरे
चलो
पूछा
जो भी है, ये कहीं ना कहीं क्लासमेटिंग हो भी सकता है, बट तुम ये देखो। ओके, सी लो, तो वो है कहाँ से आती है?
सर मेरे को बी रिपोर्टेड दैट कि
अच्छा, वो दोनों और बस दो उसके मेल कजन साथ में रहते हैं। यार, कैसे हो गए? तो मैं
कजन
वो दो यंगर कजन के साथ मेल कजन रह रहे हैं। ये एक, ठीक है। एक और भी आप स्क्वायर बनाते होते हैं, मतलब पता है इसमें भी कौन कौन साथ रह रहा है इसमें?
सेट लिविंग कंडीशंस भी शो
हाँ,
करते हैं यस सेट लिविंग कंडीशंस से डॉक्टर शो करते हैं पेज पे सही बनाया ऑप्शन में इसलिए मैंने सर ये वाला बताया था कि पंकज
But even is not saying it that answer. He is not saying that answer. He is saying
यस सर इनके साथ
ठीक है, ये गाइस इट टू मतलब कि कहाँ पे क्या एडॉप्शन में क्या करना है और करंट फैमिली को क्या लिखना है, ठीक है। तो अगर या तो आप करो, करना ही पड़ेगा आपको केस में करना चाहिए, गिवन सच ए इंपॉर्टेंट फैमिलीज। ठीक है, चलो आगे चलो। एमएनसी केस you come to admission of emergency. Question 89 में
डिपेंडेंट हाँ सर
anyway, yes,
यस सर सर
confidence is एडमिट तो कर ही सकते हो एनीवे, कोई प्रॉब्लम नहीं है, ठीक है। मतलब अगर हाउ आई रीड इट, ठीक है, आई मेक इट ऑल्सो। अगर कोई अपना बेटा होना चाहता है, चाहे वो एजुकेटेड है, ठीक है, चाहे वो मतलब हाँ, मतलब उसके सारे कैटेगरी एरिया वाले कंप्लीट हैं, तो फिर भी खुद एक्टिव हो जाएगा, तो आप एक दूसरे कर सकते हो। हाउ आई रीड इट, ठीक है, मैं डिस्कस करूंगा कभी, चाहे मैं आपके सारे एग्जाम्पल क्रेडिट है तो भी, अगर लेकिन सिर्फ मुझे एप्लीकेशन दी है तो आप एक्सेप्ट कर सकते हैं। लेकिन 89 में आप तभी एग्जिस्ट कर सकते हो जब उन्हीं को क्रेडिट अगर कोई मतलब बिजनेस है तो Actually, that particular this is not to the level of that is more ready and वो उनसे कंपेयर करें तो that doesn't mean you have to admit it 89 only. You can still admit it under 86. Even he gives the that is clearly mentioned in the law that at least I remember he a mental illness itself, whatever it is, does not by itself means that patient is not being able to take decisions. You have to prove it that he is better. Whatever is it, even if it is harm, it is for harm to self. What do you think that there है मेरे को मेंटल पर किया तो क्या आपको अकेले आके आईडी तो आप उसको अच्छी नहीं करोगे how I do still अगर पेशेंट कह रहा है 86 है 88 86 हमारे डॉक्टर का और आपको 89 में हर वीक में प्रूव करना है कि वो 89 में अदरवाइज जब हर वीक आपको बोल हाँ so how personality is valid
Then, sir, he was responsible towards its growth and he said he had interest in finance. Sir, his move was mostly stable. So his uncle reported here and he was very responsible.
So you do not find any say certain behavior, any aloof behavior, any significantly aloof behavior affecting his work and social functioning.
The professor informant is given that since 2 3 years, but sir, उससे पहले का
पहले का चाहिए पहले का
सर his uncle told me that he सारा काम टाइम से करना कि हमें उल्टा समझाना कि उल्टा खर्चा मत करो ये सारी चीजें उनके यंगर सिबलिंग्स स्कूल ड्रॉप करना जो
so you do not find any spillover traits. You don't see that there are this spillover trait, you might surprise at least that you have two plans to like celebrate your day.
yes sir
But you didn't think that there are spillover. No, 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 not that. That's the one significant spillover traits. No, like that. This is the reason why you can make that with the मतलब
yes sir the loss of consciousness and he was admitted for 8 days in ICU.
आप लोगों ने आप लोग खेल लगाओ तो मतलब एडिक्स लोग से कम वेरीफाई कर पाते हैं कि मतलब एक्चुअल में इंटेंशन क्या है इंटेंशन तो चाहिए हर टाइम अगर इंटेंशन जस्ट टू इवेज फ्रॉम द स्ट्रेसर और जस्ट टू इवेज फ्रॉम द रिस्पांसिबिलिटी है तो जस्ट व्हाट वी कॉल टीएस ठीक है बट अगर इंटेंशन आप और तो ये टाइम तो
Yes, intention to the people reported कि ये 1 साल से उससे पहले ऐसा कुछ सर भी इनमें से 20 years की एज पे स्टार्ट हुआ एंड सर ही आल्सो रिपोर्टेड कि एट द टाइम ऑफ हिज मदर्स डिमाइस उस टाइम भी मेरे दिमाग में चल रहा है कि मैं क्या करूँ मेरे दोनों पेरेंट्स हैं बट उसके बाद सर ही सेड कि ये लास्ट ईयर से दोबारा he misses them. He also reported of that. Yes, sir. तो फिर मेरे
ठीक है बट मतलब अगर but if the borderline fails, so obviously it would have closer to the opportunity. Only suicide intelligence doesn't mean getting borderline. इसलिए आप लोग मतलब जब evaluate कर रहे हो तो somehow अगर तुम्हें कोई भी ट्रेट मिल जैसे आप की मांगोगे then you go through the DSM their part और टाइम है तो आपको नहीं लगा
simply not quickly to get angry over बच्चे कितना ज्यादा एग्रेशन इतना हद हो गया है इतनी ज्यादा से फिर भी इतना ज्यादा डिमांडिंग तो चीजें most of the manual है 267 pages. देखना है मेरे को की पार्ट है क्यों सर मैंने प्री डिस्पाइनिंग फैक्टर में मेंशन कर रखा है और इसका प्री मॉडल पर्सनालिटी वेल एडजस्टेड है इसलिए तो कंट्राडिक्टरी स्टेटमेंट है
अगर मतलब भाई कोई पर्सनैलिटी मिलती है जैसे तो डेफिनेटली दैट्स फिट ठीक है लेकिन तो रैंडमली फिट तो हमारा पॉइंट ठीक है
और अबाउट दिस Normally, psychotic symptoms, plus government medical discussion like financial issue बहुत ज्यादा फिर फील सपोर्ट पेशेंट बहुत ओवर एम्बिशियस है और ओवर एम्बिशियस की वजह से पेशेंट मतलब कि मैं आईटी के थ्रू लेना करना चाहता हूँ गवर्नमेंट इंस्टीट्यूट से होटल गवर्नमेंट करना फर्स्ट टाइम तो पेशेंट रिपोर्टर मैं गवर्नमेंट इंस्टीट्यूट से होटल करना चाहता हूँ बट कंटिन्यूसली अगर उस एकेडमिक बैकग्राउंड को हम देखें तो पेशेंट के जो आंटी है वो रिपोर्ट कर रहे हैं उन्होंने क्लास 10 क्लास 9 में भी क्लास 10 के बाद फेल हुआ है तो उसको थोड़ा पुश करके पास कराया गया क्लास 12 में तो उसने ड्रॉप आउट नहीं कर दिया तो सर जो मैंने सर आपसे बात बात नहीं करी थी कि एक पेशेंट है सलमान वाला जो एसएलडी का कुछ पेशेंटों को मिल गया सर ये वही पेशेंट और इसके सैंपल भी हमने डॉक्टर को हमने सेंड कर दिए हैं तो वो उन्होंने सैंपल से फिर राइट डाउन करवाया था लाइक कि आपको कुछ चार पे टॉपिक दे दिया कि आपको डाइट को चार लाइन लिखनी है प्लीज डाइट एंड दैट की पेशेंट को सबको जनरली मैंने एक ओवरव्यू लिया था कि असेसमेंट में क्या आ रहा है जैसे हमने निभाया जैसे डी को सबका यूज किया तो जनरली पेशेंट का हमने असेसमेंट करने के लिए तो सर इस देरी को तो समझ में आ रहा है कि पेशेंट ओवर उससे होकर के अपनी जो उसकी एजुकेशनल बैकग्राउंड है उसके बिहार पे न चल के ओवर एफिशिएंट हो जाता है
ये सारा Yeah, these are vicious, but because of many limitations, the family partnering, they underlines psychological condition. तो उतना नहीं कर पाए, then it leads to family family specifically want
Search important causes very important causes compared. So he reported that he passed his 10th class with second division and he failed flunked in 12th class. But sir, he reported that there were 40 kids, out of which only 3 or 4 students passed that time. So he attributed it कि स्कूल वालों ने ही सबको ही फेल किया तो 3 4 लोग पास होते हैं तो इसलिए सर ये वही तो
कभी तो कोई ना
जी
कोई
सर
classroom essentially without intention without essentially
sir during service there was no camera but when person to put the finger in the tension generalized strength. Yes, the bed जब वो बैठ जब वो बैठ गया था तब सर वो इसीलिए तो सर ये सेलेक्ट
हमारा impression क्या है? अभी यही impression है।
हम अटेंशन नहीं देते।
कमेंट को इमिडिएट करना पड़ेगा, लेकिन इमिडिएट लेकिन तो only टेस्ट यूज कर सकते हैं। ठीक है, लेकिन तो कमेंट तो इमिडिएट यूज करना। although you can use that but digit comma digit convert is just an integer, sorry, ठीक है, but digit command तो करना है। ठीक है। और अब तुमने वो जाओ क्या करें। कंट्रोल क्या करना है।
एक सेंटर में बस अपना व्यक्ति में कुछ और मतलब स्कूल को करेंगे। तो maybe से उनको replacement हो गई थी, that's why written but sir
क्या आंसर था ये ड्रॉप कर
सर पहले सर मैंने फिगर दिखाया तो
कौन सा तुम्हें दिखाओ।
नहीं सर ये मतलब है तो ये बताओ
पहले ऊपर पहले ऊपर
तो पहले सर
आप क्या है एंड्रॉइड माइंड ओनली 20 इसमें मतलब मेरा एप्लीकेट मतलब ऑब्वियसली कि आपके स्पेशल एप्लीकेट है कम्युनिकेटिव का उतना मतलब होता है ओनली the interview starts with the select only then rules come so all disease six other parameters वो affect की बात है right वो का नहीं तो बाकी सिक्स पैरामीटर्स को कोई ले बाकी सिक्स पैरामीटर जैसा नहीं है अगर जो क्रिएटर का पहले प्रकार का नेटवर्क की वजह से वो नेटवर्क का अच्छा है अगर क्रिएटर पूरी सेट है पूरी का हम तो थोड़ा सा साइड में वो नहीं लगा सकते देन इसका बाकी पैरामीटर बिल्कुल आपने बायोलॉजी कैसा है वो
The sleep appetite.
आपका क्या है स्कूल नहीं है ऑर्गेनिक है और कुछ नहीं आपको लग रहा है कि साइकोलॉजी के लोग
Significance of reading to
बहुत सारे
simple family story.
इस देश में हम डिफरेंट टेक्निक हम मतलब अपने
So tell me some consistent. So there was 2 months of
without that yes that's inconsistent you know this part that we go not all but other while we are of second psychological but not
so there is also website things to
that at least you need to have descriptive grammar on your own and the market becoming very added on या से ideas of the office इसलिए भी होता है इसलिए देखते हैं you have to know another diagnosis at least अगर तुम बेस कर रहे हो तो psychological that logical बता दो what do you think that the motor symptoms and the cognitive symptoms are part of the same syndrome or different symptoms बताओ किस सेम सिंड्रोम का पार्ट होगा किस सिंड्रोम का पार्ट होगा इस सिंड्रोम में होपलेसनेस होता था which the dose in
yes moderate depression
हमारे पास मॉडरेट डिप्रेशन का बट हमारा पास है
yes formal
कौन से डिप्रेशन की बात करते हैं तो है दिस वेरी लॉट दिस स्पेशल तो नहीं लिखते हैं it really helps it must rule out all logical points on the basis of either investigation, history, and evidence.
so
हमारे यहाँ का जैसे हमारा finding ever said not correlated with the forensic data. आपको logical examination that is so you need a better music that is outside of the anyway now second exam five simultaneous psychotext कौन सा टेस्ट है तो आप बताइए क्या है कौन से वाला है कौन सा टेस्ट है अब आप नहीं सुनना है ऐसे रैंडम भी नहीं हो सकता है सर्कुलर टेस्ट का तो आपको सारा डाइवर्स करने का उसका तरीका है कि स्टेज में होता है टूटा टेक्निक कंपनी पेमेंट तो भी सॉन्ग से पहले आएंगे कौन से बाद में आएंगे आप उसके बाद हमको तो उसका एक पूछना कौन सा दिनों पर है कौन सा काम है वो भी समझा और ऐसे साढ़े से फर्स्ट से सेलेक्ट करना फिर सात एडिशनल लाइट का स्टार्टिंग को कैसे डिप्रेशन पर्टिकुलर स्ट्रेस को मेडिकेट There was some मतलब finally which may have led to इससे वही स्थिति आप कर रहे हैं कि मतलब एक मेडिकल इफेक्ट लीड टू फ्यूचर ग्रेविटी मतलब हम तो दिस मॉडल का कॉन्सेप्ट हमारा तो क्लियर है मतलब आपको जो गेन मिलना शुरू हो जाए तब फ्यूचर में वो उसी गेन के लिए वो अगर अभी ये डिजिटल काउंट ना हो और आपका ठीक है ठीक है और अगर आप तो आपको सेलेक्ट करना पड़ेगा कौन स्टडी उसके बाद में उसने क्या किया उसकी स्टडी क्या की कैसे किया तो आप कर सकते हैं तो हमने ये बताया कि रोड था जिससे बट मेरी तरफ से उसके बाद में बार ऑडिट करता है वो है और बिजनेस नाउ ही सेइंग कि अब तो मेरे को बुरा लगता है कि मुझे ऐसा मेरे को अभी अभी करंट आइडेंटिटी नहीं है बट करंट ऐसी कोई क्रिएट है जब आप जैसे हम लोग हेल्थ में भी वो देते हैं लेवल पे है क्योंकि वो सीधे नहीं है मतलब आपका एक बेटा को तो माइनर घर जाती है बात नहीं कर वो सीनियर है
कि मैं घर जाके सारी चीजें करूँ सर ये मैंने बोला कि ये मेरा प्लान है बट एट द सेम टाइम ही वाज सेइंग कि मैं मेरी जो ये सब चीजें इस वजह से मैं पहले रिगार्डिंग दैट ही वाज ओके मैं पहले जैसे मेरी फैमिली से तो बायोलॉजिकल फंक्शंस पर
वो सीट्स ब्रेक नहीं होना तो then we love to start for आप और सीनियर लेवल पे लेकिन और सीखना है आप चाहो तो इजी करो लॉन्ग इजी ठीक है 40 मिनट का सीधी टू आवर्स का सीधी संभाल ठीक है जब स्लीप में हो अगर आपको स्लीप बिल्कुल स्लीप में आपका इजी स्लीप वाला है और आपको टाइम स्लीप में वीडियो